Dr. Corey Paradine. Dr. Hankins was not able to be here today, and Dr. Paradine is a local veterinarian who works for Cleveland Equine. She's a wonderful vet. She's done speaking engagements here for us in the past, and we really appreciate her coming at such short notice. She's a reliable local vet, so she's a wealth of knowledge. She's going to speak to you today on vaccinations. She's going to go ahead and talk a little bit, right, and then we're going to have a question and answer session afterwards, so feel free to come up with some questions and ask her when she's all done. So thanks, Corey.
Sure. So like she said, a little last minute, so I don't have a PowerPoint fancy presentation, but what I figured we'd do is go over the diseases that we routinely vaccinate for around here, the just basic vaccine recommendations, then talk a little bit too about why we vaccinate when we vaccinate, or why we recommend vaccinate when we vaccinate, and some other factors to consider when you're vaccinating. So just with the, lots of people talk about 6 ways and 5 ways and 3 ways, and I think they throw around those terms not really knowing what that entails, which the 6-way, 5-way, whatever entails what a number of diseases that you're vaccinating for, just sheer number. 6-way, you're vaccinating for 6 different diseases, 5-way, 5. But it's important to know what those diseases are. Our clinic routinely gives a 6-way, so we'll just start there. In the 6-way, we have an Eastern Equine Encephalitis vaccine, Western Equine Encephalitis vaccine, West Nile, flu, Rhino, and tetanus. So we'll start with Eastern Equine Encephalitis. Is anyone familiar with what that disease is? And some people might be more familiar because we actually had an outbreak of this last fall. Eastern Equine Encephalitis is a really scary neurologic disease of horses, and it is 99.9% fatal. Horses don't survive this disease, and it's really, really unfortunate, and it has a very rapid progression. They get sick very fast and get very sick very fast. And being a neurologic disease, affects, but affects is what I meant to say, their brain and nervous system. So they lose coordination, usually end up losing the ability to stand, then can also lose other effects such as being able to urinate normally, defecate normally, have normal mentation, that type of thing. So it's a pretty severe, pretty serious disease. Another scary component of this disease is that people can get it. You can't get it directly from your horse, so I don't want people to get scared about that. But this disease is transferred by mosquitoes. And so if mosquitoes are in the area and Eastern Equine Encephalitis is in the area, they're transferring it to horses, potentially to people. I'm pretty sure dogs and cats can't get it, but never say never. So it's a pretty serious disease and one I highly recommend that people vaccinate for. The vaccine is very efficacious as well. The outbreak we had last year was in either poorly vaccinated horses, and by poorly I mean I think one was a yearling that had 1 dose, never had a booster, or unvaccinated animals. So we did not find any horses that were well vaccinated to come down with that disease, even though they were in the same area. So that's one. Any questions about Eastern real quick while it's on anyone's mind? Yes?
What is this area?
Ashtabula and Geauga County. Yeah, close. I don't remember offhand the exact number. I want to say it's 4 or 5 horses that were confirmed by the state. The state vet got involved, and they confirmed 4 or 5 cases, and there were suspected several more that the state vet didn't test. Yes?
Okay, what if the horse has like Cushing's disease or their immune system is suppressed? Could they still get that disease if they had the vaccination?
That's a really good question. And that depends on a little bit I want to separate your questions as far as Cushing's disease and is their immune system suppressed? Because if their immune system is suppressed, we'll just go with that term, not working appropriately, they don't respond to the vaccine appropriately. And so then they don't mount the antibodies and the defense appropriately that an otherwise normal horse would. I hold off just a little bit on the Cushing's disease because I still really recommend people to vaccinate Cushing's horses. But I also push people to treat their Cushing's horses too, because I think that well-managed Cushing's horses will respond well to their vaccines. So that's why I just wanted to separate, your otherwise immunosuppressed versus Cushing's, because I think Cushing's is a little bit separate because you can treat Cushing's and you can manage it. And what's hard about neurologic disease in horses too, not to get too far off track, is that most of them all look the same. As far as your initial presentation of equine or of Eastern or West Nile or EPM or rabies, they can all be the same. They can all show the same symptoms. There's some things that what we call characteristic symptoms that if you see that, it makes you think one disease versus another, but that doesn't mean that they'll do it. Yeah. But that's a good question, and I do hesitate, if I have a horse on some steroids to treat one thing or another, we will talk about what we can do about their vaccines. Hopefully it's a short course of steroids and we can just vaccinate when they're off the steroids, because the steroids will do the same thing as far as suppress their immune system. But certainly it's something to consider and certainly a risk to be aware of. So yeah, sure. Any other questions about Eastern?
Not just Eastern, but I saw something recently on Cushing's horses, and there was a recommendation about boostering certain vaccines on Cushing's, the Vaccinations because they were Cushing's. Do you?
I don't have a specific recommendation. I think it depends a little bit on the individual and their vaccine history. But like I said, if they are well managed in their Cushing's, they're on Pergolide, you've done the testing to know that that's an appropriate dose of Pergolide, because the dose can vary from one Cushing's to another, and they're doing well, then I don't see a reason to booster specifically, but that being said, there are certain individuals that I might be more inclined to do so because of their specific risk. But I've not read that article, so I can't comment specifically on it, but that would be my take. Any other questions on Eastern? We can skip through Western really quick because we, 1, don't see very much of it, 2, it looks a lot like Eastern, 3, it's spread by mosquitoes, so there's not much else to say, to be honest. It's a lot like Eastern. It's in this similar viral family as Eastern. It's just technically a different virus. Therefore, it's its own disease. I can't think of an outbreak of Western that I'm aware of around, but I don't know, you guys, are you aware of any outbreaks of Western? Are you aware of any outbreaks of Western equine encephalitis?
I'm sorry, maybe your question. No, I'm not.
Okay, I'm not. Yeah, I'm not either. That's why I was just checking to see if you guys had. But like I said, it's a neurologic disease of horses transmitted by mosquitoes, and it usually pretty much comes right along with Eastern as well. West Nile virus, we'll just stick with our neurologic viruses at the moment. Again, transmitted by mosquitoes. Excuse me. It has a little bit wider range of disease severity than Eastern. Eastern, anytime it strikes, gets pretty severe. And pretty fast. There are some horses with West Nile that get more mild neurologic symptoms and can survive. And they can, with supportive care, can survive. There are some horses that have had very severe disease from West Nile virus and are unfortunately euthanized because of the severity of their disease. So there's a bigger range. Like I had said not too long ago, neurologic disease, they all can present the same, which makes it kind of tough. The vaccine, has been very efficacious as well. The drug companies kind of jumped right on it when we first saw West Nile jump up, and it really stopped things from getting too carried away. And really, since we've been started vaccinating for it, our number of cases are really pretty small. We don't see too much West Nile. And even I was in vet school when West Nile first started. And the first year or two that it was out, a bunch of cases in school, a bunch of cases in the hospital. Dropped off dramatically after that, to the point they were putting in some extra isolation in padded stalls and they went empty because the vaccine did such a good job. Any questions about West Nile? Since we just talked about Eastern, Western, and West Nile, and that they are all spread by mosquitoes, I want to stop real quick and talk about why we vaccinate in the spring. Those 3 diseases are largely why we talk about spring vaccines, and that's because you want to get your horses vaccinated before the mosquito population gets too carried away and too out of control, because that's the population that transfers those diseases. There's some other diseases that we're going to talk about, and we can talk about, you know, why and when you might want to vaccinate for them. Excuse me, but the spring is largely why, or those 3 diseases are largely why we want to vaccinate in the spring. So from there, let's jump to tetanus. Tetanus is a really, really terrible disease if your horse were to get it. People get it too, so a lot of people are more familiar with tetanus than some of the other diseases. It's caused by a bacteria called Clostridia. Clostridia as a whole group are some pretty nasty bacteria and cause some pretty nasty disease. Tetanus, the clinical signs of tetanus are secondary to a toxin that's produced by this bacteria. Causes just horrible muscle spasm, muscle contracture, hypersensitivity to sound and light, and is a really painful disease. Most horses, if they get tetanus, are euthanized for humane reasons because it's just so very painful. And also too, the supportive care of a horse with tetanus is pretty expensive and pretty difficult. Anytime a horse becomes recumbent, so they're down, you get a lot of secondary issues that can be just as serious as the initial disease. So most horses, if they get tetanus, are euthanized. Again, vaccine, very efficacious. It's been around for a long time. Horses, you know, we don't see much tetanus. I'd say our practice. I can't think of a tetanus case since I've been there, and I've been there 7 years. We also, I think, have a really good vaccination program, and a lot of our clients' horses are well vaccinated. Tetanus is something that's just around. The bacteria is around. You know, people like to think of your rusty, your rusty nail. You get a little wound, and that's usually, wounds are usually how tetanus is picked up. But it's in the environment. You can't get rid of it. There's only so much you can do to minimize exposure because it's around. And so you kind of almost always have exposure. Because it's always around, that's not a vaccine that we necessarily care what time of year we vaccinate for, but it's just convenient while you're sticking them with a few others. You might as well catch tetanus while you're at it. I also do often recommend, if I see a horse with a wound and it's been 6 months since their last tetanus vaccine, I booster. It's a cheap vaccine, the disease is terrible, better off to just play it safe. I think most, I'm under the impression a lot of emergency rooms kind of do the same thing. If it's been a while, and I'm saying human emergency rooms, if it's been a while since your last tetanus vaccine, they give you one if you're in there for a wound. Way better to just play it safe, get the vaccine, and not get tetanus. Any questions about tetanus? All right, we'll talk a little bit about flu rhino, I guess a little bit together, because they're 2 separate diseases, 2 separate viruses, but they are transmitted similarly, have similar clinical signs, issues like that. Rhino we'll go into just a little bit more. So flu, people are aware of the flu. the flu's everywhere. People are talking now about dogs getting the flu too, which is kind of scary, at least the strain that they're getting. Horse flu isn't much different as far as it's a respiratory virus, fairly contagious horse to horse. Aerosol spread, though people can carry it on either themselves or equipment from horse to horse as well. Another way it can spread through a barn. Rhino, very similar, respiratory disease, fairly contagious horse to horse. The vaccines seem to have a little bit less length of time that they are effective for. So in horses that are horse showing or in boarding barns where there's a lot of horse traffic, we do recommend getting boosters once every 6 months. So in our practice, that usually ends up being spring shots, and then we do a fall shot too. If you have a horse that sits in your backyard and goes nowhere and sees no other new horses, the fall flu rhino, not so necessary. Brood mares are an exception to we're going to just talk about rhino for a minute, to the rhino vaccine program, in that rhino can also cause abortion in pregnant mares, something obviously that is not desired, especially when you've put the time and money into getting them in full. So those mares do get rhino vaccines depending on where they're at, they start at 3 or 5 months of gestation, and then get one every 2 months. So 5, 7, 9 months of gestation, they get a rhino booster because the vaccine doesn't work as long and it can cause abortion. And they've had some really terrible outbreaks in some of the big breeding farms in the country, as far as they call them abortion storms, where it's such a contagious disease, it just kind of rips through the herd, and obviously can cause a lot of economic losses as well. We'll touch briefly on the neurologic side of rhino, in that there's no FDA-approved vaccine that covers the neurologic side of rhino. Hopefully that'll happen, but I say that to the drug reps in the back. But as of right now, the current rhino vaccines that we have do not cover the neurologic disease, the neurologic form. So any questions about flu or rhino? Yes? Yeah.
Is there any other recommendations for show horses to get any additional shots to protect against that?
If show horses, I do often recommend a booster in 6 months of the flu rhino. If there's a really high risk, there's a lot of outbreak of the disease and you want to be sure you're covered, I would up that to once every 3 months. But that would be on sort of an individual risk-based assessment. Your average show horse, we do 6 months.
Is there an additional vaccine that the mares get?
The mares get, the 6-way includes the rhino, but when we're doing the mares, there's just a straight rhino vaccine that we give to the mares. Because they don't need, the other diseases don't need to be boosted every 2 months. Right, it's just, just plain rhino vaccine for them. Yes?
What would you recommend? I'm in a barn and I'm the only one that I go camping and everybody else pretty much stays there. I do what she does. I just buy the 6-way or do the West Nile separate. Is that adequate for a year, you think, then, without getting, for the other horses, without them getting the additional, well, if you got it, would you just get the influenza or just the rhino?
I would booster a flu rhino. Both flu rhino combo. That being said, it depends on your schedule. If you're camping, how late do you camp? Because if you don't camp over the winter, you're probably good until spring.
That's what I was thinking, because the winter, you don't get that stuff, right?
Well, the horses can get it, but it's a matter of, are your horses in contact with other horses where you can, So you would most likely be covered because it's not so much that those diseases aren't transmitted in the winter. The flu rhino, certainly when there's no mosquitoes, West Nile's not transmitted, Eastern's not transmitted, Western's not transmitted. But flu rhino, they can get any time of year. It's a matter of when is your horse's peak exposure, which if you're camping, I would guess would be summertime.
So you're saying this is only caused when it comes in contact with the horse that has it?
Yes.
So if they're not around other horses, then
Their contact or their risk is very minimal. Yeah, it's a largely aerosol transmission. So, I tell people when they go to horse shows, don't let your horse nose to nose, talk to other horses. Certainly, the disease can spread farther than that. If they blow their nose and it just, poof in the environment, it'll spread. But just some basic common sense as far as don't let your horse nose to nose with others. It'll minimize some of your exposure. Sure. Any other flu? Yep. Sure. I don't think so. I should clarify, not here. Okay. Not this part of the country. Yep.
I started giving my, I don't know how familiar you are, like Mohican, where they have this is Sloughtsville, Ohio. There was actually a horse that came down with Potomac.
We'll talk about Potomac in a little bit.
I thought that's what she said.
Oh, no, she said Venezuelan. Venezuelan equine encephalitis, which we don't see in this part of the country. Yeah, so I don't think it hurts anyone if it's in a combo that you happen to buy, but don't buy it separate or pay extra to have it, just not in this part of the country. Rabies is a vaccine I feel pretty strongly about, largely because of the human health concerns. Like I mentioned before, most of our equine neurologic diseases look the same upon presentation. Rabies is included. You think about dog rabies and they get aggressive and there's foaming at the mouth and those typical signs. Horses don't usually do that. So they just become neurologic. They might be more aggressive, they might be more depressed. It goes either way. So there's no hard and set way to tell, does your horse have West Nile or rabies? Because of that, lots of people get exposed before anyone knows the horse has rabies. The vet tech, the owner's friends, owner's help, if you're at a boarding barn, the caretakers, that's a lot of people exposed to rabies. And rabies is fatal. I think there's one reported person that survived rabies. But it's a really horrible neurologic disease. And it's fatal. And unfortunately, there's no good way to test for rabies. You can't test for rabies on a blood test. You can't test for rabies off of saliva. The only way to test for rabies, and this sounds pretty terrible, is to remove their head and send the brain in to be examined. No one likes to do that. So I really strongly recommend that everyone vaccinate for rabies. It's a very good vaccine. It works well. Unless your horse has had a really horrible reaction in the past. And I say horrible, I mean verging on anaphylactic reaction. I don't think a little muscle soreness is reason enough not to vaccinate for rabies, in my opinion, because the disease is always fatal and people can get it too. And most of the general public is not vaccinated for rabies. So that has some pretty serious public health concerns, at least for the people directly surrounding that horse. So I always recommend rabies.
Just common ways a horse would contract.
A wild animal that had rabies.
A bite.
Yep. That being said, though, there's been horses with rabies that the bite wound was so small that, people didn't know it until the horse had rabies. And bats, bats carry rabies and their bite wound would be pretty tiny. But yeah, contact with another rabid animal. And that's the part of the thing too, horses are largely live outside. Rabid animals don't respect boundaries. They can still wander in a barn even if you keep your horse in a barn. If they're out in the field, you don't know who do they come into contact with. So be truly able to minimize your horse's exposure is just not feasible. You have to keep them in bubble wrap, which I know people want to do for other reasons too. But it's just not, it's really hard to minimize their risk, and it's a good vaccine. Yes? They've not done the research to show that. That actually might be a better question for him.
They have not done the research. What they need to do with rabies vaccine, we have a rabies vaccine that has a duration of immunity of 14 months. And in order to prove that, they have to put these horses for 14 months in a biosecure environment where no animals, insects, or anything can get in. And really beyond that amount of time, I think the science and the people just kind of determine it might not be the most humane thing to do. To keep a horse kind of locked up for 3 years to see at what point does the rabies vaccine stop becoming effective, because the other thing too, unlike challenge studies with flu and rhino, when they challenge the horses with rabies vaccine, it's what is called a terminal challenge, and so the horses don't survive that. So we like to do that minimally.
Right. Yeah. And to go along with what he said,
But there's no guarantee that it doesn't last.
No, but hey, I'm gonna.
I'm just saying
There's not, but I'm not going to tell you you're okay for 3 years.
Oh, no, I'm not saying that there's no proof either way.
Right. Running these studies can be very expensive, very time consuming, and for rabies, it's a loss of horse life. And a rhino study, you challenge them with rhino, okay, so they get it, they get over it. It's not so severe. Any other questions? Oh, yes.
You may have said this, but how does the human get the rabies from the horse? Is it through the blowing of the nose?
It's usually, you get rabies through contact with bodily fluids. So whether, oftentimes it's saliva, but can be through, blood, urine, just some type of bodily fluid, but oftentimes saliva is how and it can be very inadvertent. Not like you're sticking your hands in the horse's mouth, but it doesn't take that much. They just, horses like to wipe their faces on us all the time. A little swipe and you have an open wound right there, and there you go. Anything else for rabies? Rabies, because it's not transmitted by an insect, and it's kind of around all the time, that is a vaccine that can be done any time of year. For convenience factor, we usually give it in the spring because, like I said, we're sticking them with a 6-way, we're already there, might as well give them their rabies too. Some people prefer to do it in the fall. I don't care what time of year people do it, as long as they do it once a year.
I read something, and I don't remember where they said that there was this test done. I give my West Nile as a separate shot, not as a combo, because they said that they found that the West Nile in the shot was not as effective as the West Nile by itself. And I might have been in Equine magazine or one of those, but that's why
I'm not aware of that at all. And I guess I'm not really sure why that would be. And another comment too would be it might very well depend on your brand, the company that makes it. Companies put different adjuvants in their vaccines. Each company's adjuvant is different. And so it might depend on the company as well. Do you have any comment on that? On West Nile is a separate vaccine working better than West Nile in a combo?
I think you answered it very well. There's been some discussion that a separate vaccine could give a higher antibody titer response. However, there's two questions. One is a higher antibody titer response in response to getting a double dose, 2 doses of adjuvant, And then the other and probably more important question is, what's a protective titer? So just because something is higher or slightly higher in terms of an antibody titer response doesn't mean it's more protective. So with the vaccine that Dr. Paradine's talking about, the 6-way, Eastern, Western, Tetanus, Flu, Rhino, and West Nile, there's just a convenience and a safety factor associated with that. Plus, if I could say from a corporate point of view, when Dr. Paradine vaccinates your horse with our 6-way, it's guaranteed.
And I really liked the point that he brought up about higher doesn't mean more protective as far as an antibody response. There's a level, just draw a line, as far as this level is what they need to reach in an antibody response to be protective. If they're here, it might work a little bit, but not so well. If they're here, they're protected against the disease. If they're up here, still protected against the disease. No better. There's no better protection from here to here. There's kind of a level.
On another note,
Yes.
I had a person this was another barn I was at, their horse did get West Nile, but it had the vaccination. And the vet said it was a much milder case. I mean, she had to treat it for quite a while. But he said that horses that he had experienced that had 2 West Nile shots a year, because he said he had run into this before, he never had a case of West Nile. They had 2 vaccinations in a year, every 6 months apart. Whereas he said he's had several with the West Nile, that it's a milder form of it. And
Was that around here?
Oh, yeah.
Okay, because horses going to Florida, I pick on Florida because that's where people usually go. Horses going south for the winter, we do often recommend a booster of West Nile. Actually, we usually end up boostering everything just to play it safe. As far as because they have mosquito population down there in the winter time. So horses going to Florida in the winter, we will booster. Our mosquito season up here is fairly limited. So I guess I can't necessarily comment on doing a booster. I have a hard time making an argument for it, and I can tell you that our practice has not seen that. Yeah.
If I may add, vaccines do not prevent disease. If you read the label closely, vaccines are an aid in preventing disease. And so even a horse that's vaccinated for flu may get flu, or as Dr. Paradine pointed out, in other regions, more temperate climates where there could be a 12-month mosquito season, well, in that particular horse, and every horse is different, if we vaccinated 2 horses, even though our label indication is that 6 months protection in an annual booster, one horse may, because of its internal makeup, last a little longer or a little shorter. So it's an aid in prevention, and then what we like to say, locally based upon the disease threat, we leave it up to the veterinarian to make a decision as to what the booster should be or shouldn't be.
Yeah.
You said that it's product guaranteed for what?
If you vaccinate a horse, if Dr. Paradine were to vaccinate your horse with our West Nile vaccine, and your horse were to get West Nile, my company would back up Dr. Paradine in terms of treating your horse.
Use the bill.
Pardon me?
You take care of the bill.
Well, I don't make that decision. Yeah.
That's what you tell me.
Basically that's part of our guarantee. But
That
all of,
guarantee just goes through if a vet gives it, is that correct?
only if a veterinarian gives the vaccine.
I understand.
And I can tell you, I worked with a veterinarian one time who we spent the afternoon, and he was telling me how easy it was to give a vaccine that a monkey could do it. And what I found in my travels, and I cover vet clinics from Ohio to Wisconsin to Western Pennsylvania to Indiana, that the veterinarian makes it look easy, because there's a little bit, if not a lot of technique to getting that vaccine in the right spot in the horse's neck between the ligament and the vertebrae, deep in the muscle, without going into a blood vessel, keeping the vaccine from seeping out through the hole that the needle's created and getting that vaccine bolus to disperse in the horse's neck. So Dr. Paradine makes it look easy because you've done it thousands of times. But I have access to all the vaccines in the world, and I do not vaccinate my own horse.
I think any reputable pharmaceutical company is going to stand behind some of their product.
Yeah, I think, yeah, I'm not familiar of any any vaccine company that doesn't have a similar claim. Right. That being said, you have to prove, though, too, that the horse got West Nile or flu or, whatever disease as far as, yeah. Right. Some people don't like to, I just say that because some people, a lot of viruses end up being symptomatic treatment and people don't always want to spend the extra money for the diagnostics. So I just want to throw that out there, that just because it seems like it's flu doesn't mean it's flu until you prove it's flu. So you can't ask them to back up a vaccine unless you actually prove that it's that disease. And I saw an outbreak of flu last year too. And this comes back to the, vaccines help disease, and certainly are those really nasty diseases like Eastern and Rabies. You want them to prevent the disease. That being said, this farm that I treat that had an outbreak of flu, of the horses that got the flu, because there were some unvaccinated horses in the barn, they were way sicker than the ones that were vaccinated. And the ones that were vaccinated ran a fever for a day or two, and that was it. And the ones that weren't vaccinated, sicker longer, big snotty nose, coughing, the whole deal. So, there's something to be said for it lessens the severity of disease. And this is where I want to jump into the Potomac vaccine. And you guys are welcome to comment on the Potomac vaccine too, because we are starting to recommend it. When I started, I'm come from Michigan. I grew up in Michigan, went to Michigan State. Michigan sees a whole lot of Potomac, a lot. Pretty much anything with a fever, and if it's July to October, they assume it's Potomac. That's how much they see. I came down here, not really the case. We don't see that much of it. A fever in July is no more Potomac than it is flu or rhino or anything else. But it's starting to creep in. Each year, we're diagnosing a few more cases. And Potomac, for anyone who, if they don't know, it's a bacterial infection that causes, at its worst, horrible, horrible raging diarrhea. And as a complicating factor, a lot of horses will then founder secondary to the diarrhea. A lot of horses with Potomac get euthanized from the founder, not so much the diarrhea. And so it can be a fairly debilitating disease and a very costly disease to treat. Diarrhea can be a very costly disease to treat, just the supportive care alone. And I know everyone in Michigan, and we're starting to do this here too, I shouldn't say everyone because I don't know everyone in Michigan, but a lot of vets in Michigan recommend the vaccine, not because it's really shown to be super great at preventing the disease, but certainly seems to lessen the severity. And if you can change a disease from raging diarrhea and laminitis to a bad fever for a few days, that's a huge improvement. And so we are starting to recommend more and more vaccinating for Potomac. So like I said, we're diagnosing it a little bit more each year. So it's kind of creeping in. And certainly people that camp and like to go to Southern Ohio, Pennsylvania, New York, Kentucky, Michigan, I'll recommend that you vaccinate your horse for Potomac. Any questions?
How is Potomac spread?
It's Mayflies, I believe.
Yeah.
Mayflies and,
Mayflies, caddis flies.
yeah.
What are things that they suggest in terms of maintaining the barn? And during that fly season, now not house flies, but these flies that are kind of associated with being near the water that trout like to eat, if you've ever seen them in a magazine. People that sometimes leave their barn lights on at night will attract these flies. These flies can then fall in, for one example, into the feed buckets.
Yeah, or their water buckets, the hay, yeah. They used to think it was,
they're mayflies.
Mayflies, caddis
Yeah.
flies. They used to think it was snails, but they proved recently it's not.
The ones that look like the overgrown mosquitoes. They're
Yeah.
not a mosquito, but they look like an overgrown mosquito, and you see them and they're buzzing around. It's mayfly. Yeah, yeah. I mean, yeah,
Yeah.
Look like a,
Yeah.
look like the helicopter mosquitoes. Yeah.
And so there's a seasonal component to Potomac horse fever as well. I come in Michigan July through October. That seems to be, at least up there, a fair assessment of the time period. We had a horse last year that was diagnosed in May. So it is seasonal, this part of the country, as far as when there's flies. So something to consider too, as far as when you're vaccinating.
These things actually bite, or is it that
No,
ingest
they
them?
ingest them. Any questions? Yep.
I'm really surprised that you're saying that this is just a current recommendation. Our veterinarian, we've been vaccinating for Potomac horse fever for years.
Well, and I say that, I'm not saying that we haven't been vaccinating for this for years. We're starting to recommend it more and more to certain individuals. As far as we have always recommended it to people that travel to these areas that see it a lot more. And some of that is just individual differences in opinion as far as what your veterinarian recommends. You know, my opinion was, you know, horses that weren't going anywhere, that were staying in this area, had minimal exposure. And so you know, if someone wanted the vaccine, I certainly wasn't going to turn them down for it, but I wasn't going to push it. I'm starting to push it a little bit more. I hope that answers that question. And there's certainly, you want to get into a debate about opinions on vaccines, we can start talking about strangles. Because I have some definite opinions about the Strangles vaccine, and I know other people have very differing opinions about the Strangles vaccine. And I don't think there's any one absolute correct answer for some of these.
But isn't Strangles one that really, if you don't move your horses, you would never, I mean, if you just stay on the farm.
Right.
Like no way.
I'm not a big fan of the Strangles vaccine, except in some very certain cases. And I'm going to throw out the disclaimer, there's a lot of different opinion about this. So, you know, I'm not trying to claim that what I'm saying is gospel or anything like that. I think a lot of horses don't need the Strangles vaccine, number one. I think your young horses, those are the ones that I'm pretty comfortable vaccinating for strangles. And I'm talking really about the intranasal vaccine. The intranasal vaccine, I think, is probably a better vaccine than the intramuscular one, if you think about it from the disease standpoint, how horses that get the disease. And what you're trying to do with the intranasal is you're stimulating their lymph nodes and their immune system in the back of their throat to form protection against strangles. Because when they get strangles, that's where it goes to. So younger horses, sure, you know, if someone wants it. Older horses, I don't think often need it. And what scares me about the Strangles vaccine, and part of why I don't like it, is if you don't know your horse's vaccine history, even if you've had them for 2 years, you don't know what happened to them the 3rd year ago or the 4th year, or say you just bought them, doesn't matter. You're unsure of their exact vaccine history. And I want to add to that, you're unsure of their exposure. Not every horse that comes in contact with strangles gets strangles. I mean, it's very contagious, so lots of them do. But your horse can be exposed to strangles without getting the disease. So if you don't know your horse's exposure or their vaccine history, but they have either been vaccinated, they've been exposed, and they have a high titer, their immune system is already built up antibodies and they're ready to fight anything that comes, and you give them the vaccine, they have a higher risk of adverse reactions. And those can be some scary adverse reactions. And so, you know, older horses, if people want the Strangles vaccine, I strongly, strongly urge them to pull a titer first. If they have a high titer, well, you don't need the vaccine because that's what the vaccine's trying to do. And then also you avoid that risk of getting that scary adverse reaction. If they have a low titer, okay, well, you're safe to vaccinate. Part of why I don't like the vaccine, and this is a little bit on my side of I have to handle it within my day. You know, I see lots of horses in a day. If I get it on my hands and then I go inject another horse an hour later, I can spread that vaccine into the next horse. The Strangles vaccine is a modified live vaccine, so that means that there's live bacteria there. It's just been modified so it shouldn't cause disease. So if I accidentally inject that into a horse's neck, guess what's going to happen? You're going to get a big Strangles abscess in that horse's neck. And I really don't want to do that. So I mean, I give the vaccine, I take precautions, I wear gloves, I wash my hands, I'm very careful about how I handle it. But I want people to know that because lots of people give IM shots. And you know, if say your vet gave a Strangles vaccine, a couple hours later you want to give them a shot of Equine, it's a bad idea. Because if they blow their nose, you know, what do horses do when you stick something up their nose? They blow their nose. Strangles vaccine kind of goes everywhere. It contacts their nose too, but it kind of gets all over the environment. So you have to be careful if you're going to stick a needle in a horse that has been around a Strangles vaccine recently, because there's a risk there. And so it's not that a risk that you shouldn't ever use the vaccine because of it, but you want to be aware of what you're doing when you're around it. Yes? I don't know the exact percentage. Do you know the percentage?
Percentage of horses that react to that
Yeah.
vaccine? As you say, that type of reaction could
be, it can be life-threatening. Not saying that all horses that have reactions to it will die, but it can be life-threatening. And they get a horrible vasculitis. They swell up, their head swells up, their legs swell up. They're pretty sick.
That's from the vaccine, that's from the intravenous.
No, intranasal. But that's an adverse reaction, a potential adverse reaction. Yes. That is something that can happen though. Horses can get purpura for other reasons. It's an older horse. I should say any horse that has an antibody level that is then exposed to the disease can get that reaction. So if you have an older horse that has a high antibody level to Strangles and they're exposed to Strangles, they can get it. I've treated a handful in my career that were not vaccine related, that were just natural exposure. And you know, I always want to weigh in any individual case, risk versus benefit. Is the risk of either getting the vaccine, or I should say, is the benefit of the vaccine outweigh the risk of giving the vaccine? And for some horses, Strangles, it's a really contagious disease. Don't get me wrong, it's gross, big abscesses, pus everywhere. But lots of horses do just fine. It's not it has high morbidity but low mortality. So lots of horses can get sick, but not many horses die from Strangles. So to me, for a large part of the population, it's not really worth it. There is part of the population that I do willingly, will recommend Strangles, but yeah. Or horses that have, for whatever reason, an increased risk of exposure. But like I said, for older horses, I always try and pull titers because you never know exactly what their exposure has been. There's horses can carry Strangles without showing signs of disease. So you don't know if this horse over here is carrying it or shedding it just because he doesn't have a snotty nose. And so you never quite know their exact exposure. Any questions? I don't even know what time it is, so I don't know how we're doing time-wise. I think we're getting close to wrapping up. Any questions about vaccines in general? I didn't talk about babies or pregnant mares. Anyone have questions in particular in regards to babies or pregnant mares? I tried to cover diseases that we see in this area. Certainly there's vaccines to other diseases that are out there if you just start looking on the internet or reading, articles, but those other ones are not ones that we see here, as far as, or can be very individual risk-based vaccines, not ones that we consider for the general population. Yes?
I did my own shots, and I've been giving mine in the back of the lung area. The vet had done that one year, and she said that so then I just started giving them because my horse doesn't react to them. She said she did that because she used to give them a nap, but she did that because she felt it got into their system faster. I don't know about that or not, but
I think really any muscle group is going to be effective. There are certainly reasons why you would want to, and these can be very personal reasons why some people want them to be done in either the hindquarters, and there's the back of the hindquarters, the hamstrings, or the top of the hindquarters, or the neck, or the pectoral muscles. There can be some very specific reasons why some people want them done in certain places, and that can be a lot very giver dependent. I don't like to get kicked, so I don't often give them in the hindquarters because I treat a lot of horses and I don't like to get kicked.
the only reason I thought it was safer for me is I never wanted to be in the wrong area on the neck.
Well, and that's a good point as far as, you need to know your anatomy. Right. But giving them in the hindquarters is not entirely benign either. Are you talking like the hamstrings? Yeah, that's not entirely benign either. There's no muscle group is entirely benign. The pectoral muscles are good muscles too, but they have you have a greater chance of hitting a blood vessel. So that's risky for that reason. The neck, if you go too low, you're close to the spine. You go too high, you're in the nuchal ligament, and it's not going to go anywhere. It's just going to sit there and not do anything. And there, nerves run through different areas. It's kind of about knowing your anatomy a little bit. But certainly, I think any muscle group, you're going to have appropriate absorption.
Is there like a triangle we go by it?
Mm-hmm. Yeah, shoulder, spine, the nuchal ligaments on top. Ma'am, sorry, you had a question.
Well, it just made me think we have an older horse, he's 36 or 7, and his neck gets terribly sore after some vaccines. Would that be something they might consider?
Talk to your vet because they might, especially if your horse is good about it. That being said, if they get sore in the neck, I bet they get sore in the hindquarters too. I just think people don't notice it so much. Well, right, and I'm not saying that you should ignore it. I just want people to think, because I hear that a lot. He gets sore in his neck, and that's fair because then they don't eat, and that's a problem. It's not unreasonable to pre-medicate with a little buterbanamine. To also, I recommend some light exercise after you give the vaccine as well. To encourage things, blood flow and moving around. Like if you get a shot in your arm, I get really sore from tetanus shots. And so as soon as I get my vaccine, I start moving because it really helps with the soreness. So, I'll tell people to do that. And certainly, if your horse is good, I would think your vet would be open to putting it in, using a different muscle group. If he's not, they might not. Any other questions?
If you have an anaphylactic reaction, do you treat with epinephrine, or how do you treat?
Epinephrine and steroids, as fast as I possibly can. Yep. An anaphylactic reaction, how do you treat it? And epinephrine and steroids as fast as humanly possible. Did you have one that had one?
Mine had one that it was not from vaccines actually, but actually went down, but then came back up on her own.
Yeah, they're scary though.
But, terrible.
Yeah. That's why I say as fast as possible. You're running. If you have an anaphylactic reaction to anything, you're running.
Oh yeah, terrible.
Yeah, yeah.
What does the horse do?
Usually they go down. They look like, not always, but they're in very severe distress. You might have sweating, the collapse usually, very high respiration and heart rate. And, you know, unfortunately, like people with anaphylactic reactions, you can die from an anaphylactic reaction. Horses can too. So that's why I say, you know, you see one, you're running, you know, running to get the epi and get it in them as fast as you can. Yeah, it's the most severe form of allergic reaction. Any other questions? Vaccines in general? When or why, or any other vaccine question? All right, I think we're all set then.